Why was Ignaz Semmelweis handwashing discovery so tragic yet vital? Imagine discovering a simple way to save lives, yet being ignored and misunderstood for decades. That's exactly what Ignaz Semmelweis experienced when he introduced handwashing to prevent infections. His discovery was groundbreaking because it proved that something as basic as washing hands could drastically cut maternal deaths from puerperal fever. Before his time, doctors didn't realize that they were spreading deadly bacteria through unclean hands. Semmelweis used a chlorinated lime solution to wash his hands and saw maternal death rates drop from about 18% to just 1% in his maternity ward. That was a huge breakthrough, showing that infection control could be simple, effective, and life-saving. But here's the tragic part. Despite these dramatic results, many doctors and medical leaders rejected his ideas. They believed diseases came from bad air or other causes, not from germs. Semmelweis' insistence on hand hygiene challenged their pride and traditional beliefs. Instead of embracing his findings, they saw him as a threat. His confrontational style and outspoken nature made colleagues resented him, and he faced hostility and isolation. Sadly, he was even committed to a mental asylum, where he died at age 47, never knowing that his work would eventually change medicine forever. His discovery was vital because it laid the foundation for modern infection prevention. Today, handwashing is a key part of controlling not just puerperal fever but also influenza and other infectious diseases. Influenza spreads easily through contact with contaminated hands or surfaces, so regular handwashing remains one of the most effective ways to protect ourselves and others. Semmelweis' work reminds us that simple hygiene practices can save countless lives, especially during flu season or outbreaks. The tragedy of Semmelweis' story is that his vital discovery was ignored for so long, causing unnecessary suffering and death. It took many years after his death for germ theory to be accepted, and for hand hygiene to become a standard practice worldwide. His story teaches us the importance of listening to scientific evidence, even when it challenges established beliefs. Today, we continue to relying on his insight to prevent the spread of influenza and other infections. Remember, practicing good hand hygiene is a simple, powerful tool to keep ourselves and our communities safe. Always follow trusted health guidelines and consult healthcare professionals for personalized advice.